I was feeling horrible. Joint pains, back pains, hypertension, sleep apnea. I was always tired. It was terrible.
You need to lose weight, and if you don't, you're going to be diabetic. I couldn't imagine having to do the needle. The threat of diabetes hung over my head so bad, and heart disease, because heart disease runs in my family.
I had reached probably the heaviest I'd been in my life, and had developed diabetes. You're headed over this cliff. You need to straighten up and do something. You know, I didn't know what to think. I didn't know if what I could do.
I went to see Miles, expecting that he would start me on some medication. But Miles had a different idea. He suggested dietary changes, recommendations for lifestyle changes that are very practical, recipes that change your diet, make you a lot healthier, and techniques for effectively losing weight. Within 18 months, I had lost that 40 pounds. I was no longer snoring, which my wife was grateful. I had normal blood pressure. I was increasing my activity. My joint pains and joint aches had gone away.
In a period of a year or so, I had lost 50 pounds. I'm no longer diabetic. My cholesterol is as good as it's ever been. High blood pressure is more under control than it's ever been. And I've been very, very pleased at the changes that it's made in my life.
Gradually, I lost, 25, 30, 35 pounds. I'm 89 years old. I am busy. If I had diabetes, I know that I wouldn't be as active and I would be certainly putting tremendous pressure on my heart and my other bodily activities and functions and organs, and I just didn't want to do it.
Instead of looking at brochures on assisted living, I'm excited about my next bicycle trip. What Miles is doing made a huge difference in my life without starting on new medications that I'm going to have to take the rest of my life.
So the quality of life for people that don't eat well or don't move every day can be devastating. I see a lot of people in the emergency department with the effects of not caring for themselves, uncontrolled high blood pressure. Active lifestyles obviously decrease the risk of cardiovascular disease by decreasing issues of high blood pressure, even cholesterol effect, and just a sense of well-being. I estimate that perhaps 25 to even 50% of medical problems I see in the ER could have been prevented by a very proactive approach and thoughtful approach to their medical care.
I first met Dr. Hassel probably 35 years ago when my husband became a patient of his. Right away, what we understood about Miles was that he looked at the bigger picture and he looked at incorporating lifestyle and healthy eating choices and alternative ideas to treating an incident or a condition that would come up. So for me, a healthy lifestyle is integral to everything. It allows me to remain in my workforce. It allows me to take care of my family members. Ability to maintain a healthy body allows you to continue to hike and play tennis and ski and do all the things that you want to do. Now we're in an aging process personally, and it's great to be able to continue to do the exercise, participate in life the way we have been. So there's modifications that happen in life as you age. It's great to have a partner that helps you step through those processes together. Everyone can get stronger. It's never too late to get started. And I would add this, there's a risk in doing nothing.
I think my goal has been to try to be healthy. I don't aspire necessarily to a certain number of years of life, but to a quality of life. I think it's really been a great journey for me. I had tried a couple of other approaches, but it was never sustainable because I viewed it as a diet, not as a change in lifestyle. And so I think anything like this, if you view it as, I want to do this and get it out of the way so I can go back to doing what I was doing before, you're not going to be successful. And so it's developing changes in your lifestyle that become habit and become ingrained. And that's not that easy necessarily all the time, but it's certainly effective.
Hello, I'm Miles Hessel. I'm a physician in practice and the founder and medical director of GreatMed.org. This is an exciting area because evidence-based lifestyle medicine has incredible potential to improve people's lives at little or no cost. Improve people's lives in the sense that we can dramatically reduce the incidence of things like type 2 diabetes, heart disease, stroke, and cancers. So at GreatMed.org, we bring evidence-based lifestyle medicine tools for physicians, for patients, for groups anywhere in the world to dramatically affect whether or not people get these diseases, and if they get these diseases, tools that they can use in addition to conventional medicine to dramatically improve, to substantially improve outcomes from those diseases.
As someone whose family has benefited greatly from this evidence-based lifestyle medicine approach, we want to help make this available to more physicians and their patients. When I asked Dr. Hassel what it would take to make this information available to a broader public, the idea of forming a non-profit foundation called GreatMed.org was established. And the goal of the foundation is to devote more time, energy, and resources toward evaluating and taking all of these great clinical results and information out there and distilling them and packaging them into care plans that can be used to treat various illnesses. We believe so much in the need for this to be extended to the broader public that we have and will continue to make matching gifts to those who want to join Dr. Hassel and his team in this endeavor. We hope that together we can make this information available to the broader public, and in doing so improve health outcomes for many, many more people.
We personally believe so much in GreatMed.org that we're willing to match your gift up to $25,000. We've been surprised to see how many people GreatMed.org has reached already. 8 different countries all over the United States. We had no idea it had that kind of impact so early on, and we'd like to have the opportunity and provide the opportunity for it to reach many more people.
Together with my family, we believe how important it is to eat good food, the right kind of food, lots of vegetables, lots of fruits, in order to maintain and develop or continue to develop a healthy lifestyle.